Ready? You ready? Yeah. Me too.
Epilepsy is a central nervous system disorder in which the nerve cell activity in your brain is disturbed, causing a seizure during which you experience abnormal behavior symptoms and sensations, including loss of consciousness. In this video, we will be discussing the frontal lobe epilepsy, the temporal lobe epilepsy, and the hypothalamic hamartoma.
Now we're going to talk about frontal lobe epilepsy.
Symptoms of frontal lobe epilepsy include weakness of the body, inability to speak, and twisting and turning. Treatments include medications and surgery. Treatments generally work with congenital frontal lobe epilepsy, but not if the cause is due to brain damage.
Now we will talk about temporal lobe epilepsy. Temporal lobe epilepsy are seizures that originate in the temporal lobe and accounts for 60% of patients who have epilepsy. Brain structures such as the hippocampus and surrounding areas are primarily affected, and contributing risk factors to temporal lobe epilepsy are head trauma, injuries during childhood, and infections such as meningitis. Symptoms include fear, panic, anxiety, lip smacking, fascination, and pleasure. Treatments for temporal lobe epilepsy are anti-epileptic drugs, surgery, and vagus nerve stimulation. Hi, can I get side stand, please? Absolutely. Thank you, sir. Yeah, you're welcome.
Hypothalamic hamartoma is a collection of non-cancerous tissue present since birth, which surrounds the hypothalamus. Hypothalamic hamartoma, or HH, may or may not cause symptoms and can go undiscovered until later found on an MRI due to unrelated causes. Symptoms of HH include seizures, irritability and aggression, and early puberty. Most commonly, seizures are marked by gelastic seizures, where the person spontaneously laughs or giggles, or dicrastic seizures, where the person cries and grunts. Treatments include surgery, ultrasound, seizure, and hormonal medications.
I don't know how a person freaking burps so much. I don't know how.
Okay, hold on. Okay, go. Wash them off. Ready.
Are you okay?
Tell me when you're gonna hit the button. By nodding your just by nodding your head. Give me Tell me that guy does not look like the guy from Duck Dynasty. Brain structures such as the hippocampus and surrounding formations affected and risk factors that can contribute to temporal. What should I say?
Testing.
Go ahead. Testing 1, 2, 3, Betty Boop. Detected during temporal lobe epilepsy, and during temporal lobe contributing risk factor. Ready? Do the brain structures such as the hippocampus and surrounding areas are Brain structures such as the hippocampus and surrounding areas are Ready? What? Go. Just do it? And he'll like edit it or whatever. Brain structures such as the hippocampus and surrounding areas are primarily affected. And contributing risk factors contributing risk factors to temporal lobe epilepsy. Today, Junior. Never mind. Anxiety, lip smacking. See, I gotta get us right. And go. Symptoms include fear, panic, anxiety. Around, oh my Christ. Lip smacking. Can't clench. Damn it. Yeah, they get me. Treatment for temporal lobe epilepsy are anti-epileptic drugs. Seizures. What? Treatments for I'm sorry.